Ladies and gentlemen, thank you for giving me the opportunity to speak to you today on a topic which we can summarize by saying that Indiba treatment reduces post-operative eyelids surgery scarring. There are two things that we need to know. This is Indiba. Indiba is radiofrequency treatment, and Indiba have developed a protocol for blepharoplasty, for eyelid surgery, and it works well in Indiba for various indications. We know that, if I can press forward, so Indiba is a monopolar radiofrequency device. It's been around for many years. I think we first got our device 7 or 8 years ago. We now have 3 in our clinics. It's a monopolar radiofrequency device, but the key is that it uses radiofrequency at 448 kilohertz. And it has a capacitive function, a resistive function. It's non-ablative, non-invasive, and patients describe it as a very pleasant sensation. And it has various scientifically proven effects. It has an anti-inflammatory effect, and there have been enough studies looking at Indiba showing the anti-inflammatory function. It comes from a background from orthopedic surgery and veterinary surgery, where we know that soft tissue injuries, which are characterized by an inflammatory response, heal more quickly when Indiba is used in these injuries. And it's been translated over into aesthetic medicine. Its regenerative functions and its anti-inflammatory functions have been used to improve wound healing, tissue repair. And as a side effect, people are noticing that their skin is tighter, there are fewer fine lines and wrinkles, and so we have an indication for fine lines, wrinkles, cellulite reduction, and lipolysis. So that's Indiba. This is blepharoplasty. So an upper lid blepharoplasty is when someone has hooded eyelid skin, they have dermatochalasis, and this is what we do. We remove a strip of skin, an elliptiform shape of skin, along with a strip of the underlying muscle. And I don't have a video of this, but I can flip through some pictures very quickly. So you can see the edge of the muscle there, and the edge of the muscle there. Deep to the muscle, we have something called the orbital septum, which divides the outer surface of the eyelid from the inner part of the eye. And we just tighten that with some bipolar radiofrequency. That's how we do it. And then at the end, we just stitch it up. And this person had a lower lid blepharoplasty at the same time. So we now know what Indiba is. We know what blepharoplasty is. We wanted to combine the two because after eyelid surgery, we get some scarring and swelling. And thankfully, we don't see too much by way of scarring and swelling. But we know that Indiba reduces scarring and swelling. So we combined the two, and we performed a study. So we took patients who were having eyelid surgery, blepharoplasty, upper lid blepharoplasty, and of course some of them were having other procedures at the same time. And we investigated whether Indiba would make a difference to their outcomes. So I would perform the surgery, and my staff would perform the Indiba. We're using a very specific protocol. And I made an assessment of the scars afterwards. Not all my patients who had eyelid surgery, who had upper lid blepharoplasty, were able to commit to the schedule that we had for their post-operative and preoperative blepharoplasty surgery, because I see patients from out of town. And so we had 13 patients who agreed, but at the same time, there were a number of other patients who were going through blepharoplasty surgery who were not having Indiba at the same time. So when I saw all my patients at 6 weeks, because I see them 6 weeks post-operatively, I noticed that all their scars were paler, softer, and had no swelling in the upper eyelids in comparison to some of my non-Indiba patients. So here are some of the before and afters of the blepharoplasties in the upper eyelid. Now, some of these patients will have had lower eyelid blepharoplasty at the same time, and you can see this patient has had lower eyelid blepharoplasty, and these are results at 6 weeks. And whilst the protocols were designed for upper lid blepharoplasty treatments, when you look at someone like this, 6 weeks after they've had a lower lid blepharoplasty, this is a result that we would expect to see maybe 3 to 6 months down the line. The scars that I was feeling they were softer, they were less red, they were smoother. And after a while, I could tell, you've had Indiba, you were one of the Indiba patients, and you weren't one of the Indiba patients. It was very obvious to me that the scarring was significantly reduced. Some of my patients, as I say, they had lower lid blepharoplasties. Some of them had laser surgery to the lower eyelids as well. This patient had an upper lid blepharoplasty to treat the xanthelasma that she has in the upper inner aspects of her eyelids. Again, this is a 4-lid blepharoplasty. And these results are all at 6 weeks. And the photographs that we took, they were standardized. And you can see this patient had a lower lid blepharoplasty at the same time. Again, upper lid blepharoplasty and 4-lid blepharoplasty. This patient had an infection in the lower eyelid following her blepharoplasty, and she made a dramatic improvement. At this stage, we would not have usually expected her to see such an improvement with her lower eyelids, but she made a more rapid recovery, and I believe this is as a result of the Indiba treatment. So, after blepharoplasty, scars are usually good quality. They're usually soft, they're smooth, they're not really too red, they're not too wide, but it can take some time for our scars to mature to that level and to that point. I usually say to my patients, give it about 6 months and we'll see the final results of your scars, and over a period of a few weeks we see gradual improvements. But with Indiba I was seeing softer scars at 6 weeks. And I would ask my patients, I sometimes forget how long it's been since I've seen my patients, and I would say, oh, is this your 6-month checkup? And they would say, no, this is my 6-week checkup. So, in conclusion, Indiba, I think it reduces scarring post-operatively after upper lid blepharoplasty. We've had no adverse effects from the treatment itself, from the Indiba, and in fact our patients describe a very positive experience from the treatment, and these are our conclusions.
Thank you very much. Tamer, could I have... Tamer, thank you so much. That was absolutely fantastic. I mean, obviously speaking from a plastic surgery perspective, that swelling reduction for lower blephs is pretty incredible, actually.
It is, and we've used Indiba on a number of cases over the past several years, but we never really formalized any of our findings, and we never really formalized it into a research protocol. But seeing lower lid blepharoplasties recovered to that degree so quickly, it's just so obvious that it's because of the Indiba.
We've got some more questions, but could I ask, well, we'll go first, yeah. So the question is, what temperature does the skin achieve using Indiba?
So we have a specific protocol, and we ask the patient, it's a patient-related measure on a scale of 1 through to 10. And let me just go back a few slides, because we will see the protocol is, there we are. So our blepharoplasty protocol was high heat score for 30 minutes in total. It's a bit fast, I can't really read that quickly, but I will do this again. Here we are. So for the protocol is very specific for blepharoplasty, but the Indiba instruction manual comes up with different protocols for different post-operative requirements. So there's a blepharoplasty protocol, there's a liposuction protocol, there's a facelift protocol. There are different protocols for different treatments. Let me see if I can...
Could I, so you're talking about post-operative with regards to some of the stuff that we do. How have you used it? Obviously, you've got 3 in your clinic. Yeah. What are your main indications that you like to use for the benefit of somebody considering buying an Indiba machine?
So there are 2 main indications. There's surgical, there's non-surgical. For the non-surgical side of things, again, there are protocols for lipolysis, for cellulite reduction, for fine lines and wrinkles. And it depends on the location of the fine lines and wrinkles, depends on the location of the cellulite as to what protocols are used. And these have been developed by the manufacturer over the past several years.